So this is a patient who's brought in because they had a stool test that was positive for a trace of blood. And that is a strategy used in British Columbia to screen the population for precancerous lesions. So everybody over the age of 50 without other risk factors would do a stool test every 2 years. And if the test is negative, they just keep repeating that. And if it's positive, then they get referred for a colonoscopy. And the purpose of colonoscopy is to look for precancerous lesions, so it's preventative screening. So the province has put a lot of investment and time into colon cancer prevention. And we know if we do these procedures and we find these polyps at an early stage, we remove them, we prevent them from turning into cancer over time. And then on the screen you may see some flickering green boxes, and that's the AI system. So that's a system that's just implemented across Fraser Health to help us detect polyps and remove them appropriately. And so our goal in Fraser Health is to make sure that wherever a patient goes throughout the region, they get access to the same high quality endoscopy. So we really want to democratize screening so patients, no matter where they go, know they're getting the best care for them. So you can see that box lighting up a very small polyp. So we're going to take that out now. There's good studies to show these AI systems are quite effective. So in large randomized trials, they've been shown to increase the detection of adenomas by up to 30% compared to not using them. And also in Canadian studies, they've been shown to be cost effective. So yeah, that's good. Again, this is all magnified, so it looks like a large amount of tissue or not is just so that's clearly an adenomatous polyp. You can tell by the surface pattern and the morphology of the polyp itself. So that kind of polyp, if you leave that in place for long enough, so that will be the next sort of iteration of this technology. Okay, we're just going to turn this scope backwards.
It's again very small.
Colonoscopy is a very visual diagnostic tool. It relies on the team, so the endoscopists and the nurses in the room, to look at the screen very carefully and detect these lesions that can be quite subtle. And we know from studies they can be overlooked for various reasons. It's either the valve preparation, the state of the equipment, the attention of the team to those details. The AI system employs an additive benefit because you have a second set of eyes in the room. You have a computer system that's looking at these digital images in real time and drawing your attention to something that may be abnormal. We know from studies that this doesn't significantly increase the length of the procedure. The system is quite accurate in detecting what is abnormal and what isn't based on these large databases they use. And the end result is you have an objective observer on your shoulder all the time, not tired, looking at the screen, pointing out something that may be of concern. You know, I see this as one of the early steps in Fraser Health and in British Columbia in riding the wave of the AI revolution that is coming into medicine. Artificial intelligence and machine learning is going to impact all facets of medicine. both from the lab-based level in terms of determining protein structures to develop new cancer therapeutics, to clinical applications. And we see this as one of the early adoptions of the clinical applications of AI to medicine.
I guess how far the scope actually goes in for the full colon, it can go up to about 5 feet. We go in up into the small bowel, and that sometimes shocks people that we go in so far. We do inflate. A lot of people don't know that we do put a lot of air in there so we can get a good look at all sides of the colon. And yeah, that's about it. So they get a little bit of sedation. They're not fully out, but they can watch their procedure up on the screen if they choose to do so. If we are taking polyps out too, this is the chamber that we go into. We have a lot of snares and biopsy forceps that can fit through the channel, and it comes out through the end of the scope itself, and that is how we snare our polyps and take off the polyps or take biopsies through that. And we just test it. So we have buttons here. This is just a test for the CO2. You'll see that it can clear the lens there. It also inflates. We have our suction. You can see as it gets suctioned up through and it goes into our canister there. That's how we collect our polyps too. They'll get suctioned into a little trap that is attached to that, and then we can flush with the water. We have a little trap that sits into our suction like this, and then it gets caught in the trap so that we can then remove it and then send it to the lab.